Okay, so we're going to look at Flexor Carpi Ulnaris, which is this muscle right here on the side here. Now, this is an important muscle. Once again, like trigger point referral will refer basically out to the ulnar part of the wrist, if you like. But it is also involved in entrapment of the ulnar nerve itself. So if I take this off here, you'll see basically coming up underneath here is the ulnar nerve. Okay, obviously it supplies these ulnar aspects of the hand. So underneath here, the ulnar nerve passes through here, and even the medial tricep can also be involved in entrapment. So these are two really good entrapment sites here. Once again, it's right on the outside. So it's one of those muscles that sometimes get a little bit missed because we're always concentrating on this more meaty part of the actual flexors themselves. So always take your time to work this ulnaris. It's an easy muscle to find. For most people, all you really need to do, as I've said in the past, they make a fist and then they basically go into ulnar deviation, and you can see Seb's comes up right through there. Okay, so that is your Flexor Carpi Ulnaris. Okay, so treatment-wise with them in this position, as long as their elbows supported and there's got no pain there, it's going to be pretty easy. So, as you can see, it comes all the way down here, the tendon. Bulk of the muscle belly is in the upper half here. So this is where we're going to start, okay? So we don't want to be up against, there's the ulnar bone itself there. So we don't want to massage the ulnar bone. You need to roll off the ulnar bone and be into that fleshy part of the Flexor Carpi Ulnaris. Now, the trigger point for this muscle is usually once again in that mid to lower part of the muscle belly itself, okay? And as I said, it'll refer all the way down here and primarily out to the ulnar area of the wrist itself, okay? So simple, okay? We just engage, obviously, the muscle belly. We're just going to work through. This time, as always, we're not using our fingers, we're using a broad approach, okay? Really important that we're using that broad approach. We're going to work all the way down there. And like if we can with any of these techniques, we want to try and bring in some passive range of movement. So I'm going to bring in a little bit of radial, ulnar deviation, and just work through and basically take it all the way up. Just stop short of the epicondyle up there. Okay, so once again, pick up the belly of the muscle all the way through. Little bit of ulnar radial deviation. I'm doing it passively because I can control the movement, how much movement I want. Sometimes if your clients do it, they push too much and too hard, and you sort of disengage from the tissue. Trigger point, as I mentioned before, is going to be in the belly. Okay, so start down about here. I reckon that's about there, Seb. Yep. Okay, and as I said, classic referral is down into the ulnar surface of the hand. I'm going to make sure that your clients are supported here. Okay, it's not too much on the actual elbow itself, and certainly no issues with the shoulder itself as well. Okay, so coming down and working across through that. Flexor Carpi Ulnaris, great muscle. Do not miss it. Okay, so bony landmarks, ulnar bone here, roll off. You're going to be in the belly of that Flexor Carpi Ulnaris. Easy muscle involved in obviously ulnar entrapment. Okay, so cubital tunnel syndrome. So really, really, really important muscle. Okay, here's the muscle here. We'll get you to push up into radial deviation. There we go. There's the bulk of the muscle there. You can see it. Big muscle. Okay, relax. Okay, we're going to look at treating this half here, trigger point in and around that area there. So in we go. Okay, add a little bit of wrist, radial deviation, ulnar deviation. back and forwards along, pick up that trigger point. Okay, trigger point's going to be in this area, so we can just work a little bit of in and out of that area there, keeping a broad approach, not using our thumbs, using our body weight, and just working nice and slowly through the tissue. We don't want to rush through these techniques. Okay, so we're just trying to engage in a really slow and purposeful manner. And all the way up, let's just stop at that, below that epicondyle. Okay, so this is the area we're working. Okay, there's the ulnar bone there, so we're not massaging the ulnar bone. We're over, bang through there.